Hey everyone, welcome back for another deep dive. Today we're tackling a topic that's close to all of us, healthcare.
That's right.
But we're not just talking about bandages and prescriptions.
Nope.
We're digging into something much deeper. Diversity and inclusion in healthcare.
It's about time, right?
Absolutely. We stumbled upon this fascinating presentation, and let me tell you, it really got us thinking about how we can make healthcare work better for absolutely everyone.
Everyone deserves quality care.
100%. So before we get ahead of ourselves, let's define what we actually mean by diversity and inclusion in the context of healthcare. What are we really talking about here?
Well, when we say diversity, we're talking about recognizing and valuing the unique characteristics of every single person who interacts with the healthcare system.
Okay, so that's like patients, doctors, nurses, everyone, right?
Exactly. We're talking about everything from ethnicity and gender to age, sexual orientation, religion, abilities.
It's about the whole spectrum of human experience.
Precisely. And inclusion.
Yeah, what about inclusion?
That's where the rubber meets the road. It's not enough to just have a diverse group of people in a room. Inclusion is about fostering an environment where everyone feels welcome, respected, heard, and empowered to contribute their unique talents and perspectives.
So it's not just about checking boxes, it's about creating a space where everyone feels like they truly belong.
Exactly.
I love that.
Yeah.
Okay, so we've got a handle on what diversity and inclusion mean in the big picture, but let's bring it back to healthcare. Why does all of this really matter for, the actual delivery of healthcare?
It matters more than you might think. For starters, imagine yourself as a patient. You walk into a hospital, maybe feeling a bit nervous, a bit vulnerable.
We've all been there.
Right. Now imagine if your doctor not only understands your symptoms, but also your cultural background, your beliefs, your concerns.
That would make a huge difference.
A world of difference. And that's what diversity and inclusion bring to healthcare. It's about creating a system where every patient feels seen, heard, and understood, which ultimately leads to better care, better communication, and better health outcomes.
It's about building trust, right?
Absolutely. And there's actual research to back this up. This presentation cited a study where patients from marginalized communities reported feeling significantly more comfortable and respected when treated by a diverse medical team.
That makes so much sense. When you feel understood, you're more likely to be open and honest with your doctor, leading to a more accurate diagnosis and treatment plan.
Exactly. And it's not just about the patient-doctor relationship. Diversity also plays a major role in fostering innovation in healthcare.
Oh, that's really interesting. Tell me more about that. How does that work?
Think about it. When you have a group of people with different backgrounds, experiences, and ways of thinking, you're more likely to come up with creative and effective solutions to complex problems. Diversity fuels innovation.
That's a great point. Do you have any examples of that from the presentation?
Sure. They actually use the example of telehealth, which has really taken off, especially in the wake of the pandemic.
Yeah, telehealth has been a game changer.
Right. But did you know that a lot of the drive to develop telehealth came from a need to reach underserved communities in rural areas and places where access to healthcare is limited?
That makes a lot of sense. It's about recognizing the unique challenges that different communities face and coming up with innovative solutions to address them.
Precisely. And you can see the same principle at play in the development of new medical devices, treatment approaches, and even public health initiatives. Diversity drives progress.
Okay, so we've covered how diversity and inclusion lead to better patient care and increased innovation. But what about the folks on the front lines of healthcare? The doctors, the nurses, the support staff, how does this impact them?
That's crucial too. Imagine working in a place where your voice is valued, where you feel like you can bring your whole self to work, and where you have the opportunity to learn and grow alongside people from all walks of life. That's what a truly inclusive healthcare environment looks like.
And that kind of environment has to be better for everyone involved, right?
Yeah.
Happier staff, better patient care.
Exactly. Studies show that hospitals and clinics with diverse and inclusive work cultures have higher employee satisfaction rates, lower turnover, and even better patient outcomes.
It's all connected.
It really is.
So we know diversity and inclusion are essential, but let's get down to brass tacks. How can healthcare organizations actually make this happen? What are some concrete steps they can take?
It all starts with leadership.
Okay, leadership needs to be on board. That makes sense. But what does that look like in practice?
It's about more than just saying diversity is important, right? It's about taking real, tangible action to weave diversity and inclusion into the very fabric of the organization.
So what would that look like, practically speaking?
Well, for starters, it means ensuring that diversity is represented at all levels of the organization, from entry-level positions all the way up to the boardroom.
Right, making sure that leadership itself reflect the diversity of the communities they serve.
Exactly. And it's not just about representation, it's about creating a culture of inclusivity where everyone feels comfortable speaking up and sharing their ideas, where unconscious biases are addressed head on.
The presentation talked about unconscious bias training. Can you explain a bit more about that?
Absolutely. Unconscious bias training is all about helping people become aware of the hidden prejudices we all have, even if we don't realize it, and then giving them the tools to challenge those biases and make more objective, equitable decisions.
That's fascinating. It's like holding up a mirror to our subconscious.
Exactly. And it's especially important in healthcare, where even subtle biases can have a big impact on patient care.
Absolutely. The presentation also mentioned something called reverse mentoring. Can you tell us a bit more about that?
Yeah, reverse mentoring flips the script on traditional mentoring. It pairs senior leaders with junior staff members from different backgrounds. The idea is to create a space for open dialogue and mutual learning.
I love that. It breaks down hierarchies and encourages perspective sharing. It seems like such a powerful way to build empathy and understanding.
Exactly, and it can lead to some incredible insights and positive changes within the organization.
So beyond leadership initiatives and unconscious bias training, what other strategies can healthcare organizations implement to foster a more inclusive environment?
One really effective strategy is establishing employee resource groups.
What are those exactly?
They're basically voluntary groups where employees from diverse backgrounds can come together to connect, share their experiences, and support each other.
It's like creating a built-in support system within the workplace.
Exactly. And these groups can also play a vital role in advising leadership on diversity and inclusion initiatives, ensuring that the organization is truly meeting the needs of its diverse workforce.
It's about making sure that diverse voices are not only heard, but actually listened to.
Absolutely.
We've talked about internal changes within healthcare organizations, but what about their role in the broader community? How can they ensure they're truly serving the needs of diverse populations?
That's a crucial point. It's not enough to just create a diverse and inclusive environment within the walls of a hospital or clinic. Healthcare organizations have a responsibility to engage with the communities they serve in meaningful ways.
So how do they do that? What does that look like in practice?
It can take many forms. It could involve partnering with local organizations to improve access to healthcare, offering health education programs tailored to the specific needs of diverse communities, or even just creating spaces for open dialogue and understanding.
It's about building bridges and breaking down barriers.
Exactly. And it's about recognizing that healthcare is not a one-size-fits-all proposition.
That makes sense. Different communities have different needs.
Exactly. So healthcare organizations need to be flexible, adaptable, and willing to meet people where they are.
This has been incredibly insightful. So to wrap things up, what's the key takeaway you want our listeners to walk away with?
Diversity without inclusion is like a beautiful symphony orchestra where only a few instruments are allowed to play. It's nice to have all those instruments, but
You're not going to get the full effect.
exactly. We need all voices, all instruments, all experiences to create a healthcare system that truly sings a system that works for everyone.
Beautifully put. It's about recognizing that every single one of us has something unique and valuable to contribute, and that our differences are not just something to be tolerated, but celebrated. So as you go about your day, I encourage you to think about how you can be an advocate for diversity and inclusion, not just in healthcare, but in every aspect of your life.
You're here.
Until next time, stay curious, friends.